Why was somebody who trained in US, anywhere, who is a Nigerian, why will you want to start thinking of coming to your country? Why? When, quote unquote, you have all those things over there in the US. I chose to come here because this is my country. I chose to come here because I've been blessed to have the skills from there, and I want to give back here. Then the next question I will ask. I sat down there listening to all the presentations. Excellent presentations. By the way, he mentioned a lot of, the previous speakers mentioned a lot of what I want to say, but I'm going to be able to add a few more. It was good listening, especially your presentation. And listening to the nurse from the nursing perspective. So my question to the audience is this. Based on everything you have heard today, do you think Nigeria is on the path towards clinical pharmacy? Do you think Nigeria is ready for the final goal for clinical pharmacy? What are your thoughts? What do you all think? And I will share with you guys what I think. Based on what you heard today, are we ready?
Yes, we are.
Very good. Do you all agree with him?
Yes.
Did you all hear some familiar things you're already doing? Right. And I'll share something with you guys. When I started Dr. Madu, you cannot ask for a better leader. That one I will say. And I also want to seize the opportunity to thank the previous professors, people like you, Dr. Yudo, who started clinical pharmacy. I did not start clinical pharmacy here. I came and just added to it. So kudos to all the people that started clinical pharmacy, that thought about clinical pharmacy. Kudos. I remember when I started talking to Dr. Madu, they were not at the stage they are today. So I know the progress that has taken place from about 2 years ago to where it is now. Very impressed with the people they brought from US, from UK. Alright. You're looking at clinical pharmacy. At the forefront of healthcare transformation stands clinical pharmacy. Alright, and I want you all to listen. Uniquely positioned to bridge the gap between medical science and patient care. Through the integration of evidence-based practices, medication management is one, you all heard that. Patient education, clinical pharmacists serve as, and I want you all to listen to this word, as catalysts for positive health outcomes and sustainable healthcare delivery models. So you all believe that here in Nigeria, we are positioning ourselves for this, correct?
Yes.
Then why is it that you guys have heard that we're piloting a residency program in Del Street? Why is it that sometimes, I would say 50% of the time, we hear the same thing over and over again? And what do you think that is? What do we hear over and over again in Nigeria as it pertains to pharmacists and other healthcare providers? Do you all see, is the teamwork consistent? Are you able to round floors, patient care areas? Yes or no?
No.
When you as a pharmacist call a physician and give a recommendation, do you feel like the physician is taking the recommendation most of the time? Yes, no? Sometimes. Maybe 30% of the time. Okay. We did when we were doing the PharmD, and I have to thank our past registrar here. The opportunity for the PharmD started with his initiative. A lot of what they said, I didn't do alone. You guys gave me the opportunity to participate, and I want to thank you for that. So, why is it at that time we could not round in one of the teaching hospitals? So here we had the pharmacists, we brought people all the way from US, but we could not round in any of the teaching hospitals, and it's not just there. So can we comfortably say that as pharmacists, we are given that opportunity to be part of the healthcare team? What are you saying? I would say no. So the point I'm trying to make is we still have opportunity. And let's find out why. Why is that so? Why is it that we still have that opportunity? There are certain slides, guys, that I'm going to go to because a lot of them they've said it. I want to go straight to the point what makes sense. What the issue we have. So the issue we have is lack of interdisciplinary approach. Physicians working with pharmacists, they even somewhat better with nurses like she mentioned, but pharmacists working together for the benefit of who? The patient. So I think what I'm saying is that patient-centered care is still not where it should be. The other point I want to make is this before we go on. All pharmacists are clinical pharmacists, irrespective of your area of practice. Whether you're in community, whether you're in hospital, whether you're in academia, whether you're in industry, you are clinical pharmacists. Like my president-elect said, what it takes is what? Your willingness to want to do it. The other point I want to make is, what did you all notice about the speakers today that was common? All the speakers, starting with him. What did you all notice? What did you all pick up just listening to them that was common? Passion. They are very passionate about what they do. He was very passionate at the point about the point he wanted to bring up. She was. The point I'm making is that if you love what you do, when there's a what? When there's a block, you will find a way. And I will share some things with you guys. Being passionate with what you do. So the only role of pharmacists, we're going from the traditional dispensing to patient-centered care. And we're already determined that in Nigeria, we're moving there, but we're not quite there yet. We still have some work to do. We're expanding to clinical pharmacy services, public health, and healthcare technology. That's another key point. We need to talk about clinical pharmacists, the role that the diaspora pharmacists also will play in terms of where we need to go. Next slide. Next slide. Okay, right. This is the SCP definition of clinical pharmacy. A health science discipline in which pharmacists provide patient care that optimizes medication therapy and promotes health, wellness, and disease prevention. Do you all see what I'm saying? That pharmacists in the community are also involved. In what area will the pharmacists be involved in the community? Wellness. So a patient comes to your community. to your pharmacy. That patient is diabetic. You have a prescription for the anti-diabetic medication. As a pharmacist, if you clinically assessing that patient, will you not be looking at not only is it the right dose, the right route, right? But what else will you be looking at? Will you be looking at the lab, the A1C? Will you be asking the patient how the patient feels? Will you be asking the patient about the nutrition, how the patient is eating? Will you be asking the patient about what? Lifestyle changes. Isn't that clinical pharmacy? What do you need to know that you have to do that? Knowledge. If you don't have the clinical knowledge, you won't know what to ask. So the point I'm making is that in the community, and what is the impact of what you're doing? The community pharmacists, you guys are the most valuable pharmacists, if you ask me. You know why? Because you're not the ones that keep the patient well. You're not the ones that prevent the patient from what? Being admitted to the hospital. Community pharmacists, you guys are the gatekeepers. You all are the ones that make sure that all these things are being done and the patient stays well. And the patient doesn't stay sick and get admitted. So that's important. Now, next slide. These are some of the pharmacist's contributions. You all have heard all this. Medication management expertise, the bridge between medical specialties. A clinical pharmacist in the hospital, you round in with the physician, with the nurses. You are the ones that is making sure you are the bridge between what's going on with the physician, the patient, and the nurse. Chronic disease management. The common ones are diabetes, hypertension, COPD, dyslipidemia. And another thing that I'm going to mention also is the nutrition. Pharmacists need to have an appreciation for that. Coordination of care, that's becoming important. There's a study that we're going to start in Lagos. We're going to be looking at like 10 pharmacists. We call it that study, value-based pharmacy practice. And what are we trying to show? We're trying to show that pharmacists have value. And there are two ways you can prove your value. What is it? Recognition, and what's the other one? Behavior. You show your value if you're able to get reimbursed for what you do for that patient. So we're looking at reimbursement for clinical pharmacy services. So we're going to start that very soon. So that's what, and a lot of it has to happen with chronic disease management. Medication safety and quality, pharmacists play a role. Patient education and empowerment, you all heard that. And then preventative care. That's what I was talking about, the community pharmacists really focusing on that. So by omitting or underutilizing the pharmacist, a huge gap occurs. So pharmacist expertise can help complete the course. Next slide. This is what I was talking about, the diabetes management team. Do you see all the people involved in that? You have the dietitians for the nutrition. You have the endocrinologists, the social workers, the patient, pharmacist. So pharmacist is in with all these specialists. And that's what diabetes management team. So if you all look, all these and benefits shows you have to have innovative solutions. What I was talking about, the value-based pharmacy practice is innovative. You have to have enhanced communication and collaboration, like the previous speaker mentioned. And then you also have to be able to build capacity building. Alright? So this is, so So more successful systems, they utilize an interdisciplinary approach. And that's what it looks like. Everybody working together for the benefit of the patient. Next slide. So what are the facts? We know that healthcare in Nigeria, we're facing some challenges, including inadequate infrastructure, limited access to healthcare services, and disparities in healthcare delivery between the urban and rural areas. Next slide. The pharmacist's vital role in the healthcare system as medication experts and frontline healthcare providers is unrecognized. That gap, the pharmacists can really close the gap. Because the pharmacists can provide medication counseling, they can also dispense medication and offer valuable advice on medication management. Next slide. We already talked about that the full potential of pharmacists is often underutilized, with many pharmacists confined to traditional dispensing roles rather than engaging in comprehensive patient care. Next slide. These are, when you're looking at the challenges that we have, you already heard about the structure. The key thing I will continue to say is that pharmacists are underutilized. The question is, why are they underutilized? Is it because they want to do that way, or the system makes it that way? What do you think? You all know what I'm saying. I've been to hospitals and I've gone past pharmacy. And then you know who I will see in the pharmacy? The pharmacist. Their door is shut. They're in the pharmacy. They're not out. Why do you not think they do that? Why do you not think pharmacists do not want to come out? Tradition. How about intimidation? How many pharmacists are comfortable to actually talk to the physician, run with the physician? Because if they are trained, then they may ask them questions. So the point I'm trying to make here is intimidation, and also what? Exposure. And you know where they should have been exposed? Where should they have been exposed? We can say the registrar is a pharmacist who trained in the US, right? And I'm a pharmacist who trained in Nigeria, right? If you compare him, who trained in the US, to me, who trained in Nigeria, and you look at the academia, who is stronger? Academic. Guess who is stronger? Nigeria. But when you look at application, guess who's going to be stronger? US will be stronger. And now I forgot who is US and Nigeria when I see something. Yes, US will be stronger. And why is US stronger? Environment, and what happened in the school. Guess what? In the US, starting from second year, we already been exposed. Then in the last year, we have rotations whereby we're rounding with doctors, with nurses, we exposed. So they've already broken that chain. And then the other point I want to make is that in the US, after you finish your pharmacy degree and your program, you also go to what we call a residency. If you want to practice in the hospital, and even if you want to practice in the community, there's a residency for community. That residency gives you additional 1 year of just practicing, just being available to practice. So you build up the skills. So that is what happens here. So there's also limited opportunity for innovation. So those are some of the challenges. Next slide. Pharmacists can bridge the gap. We need to talk about how can we do it in Nigeria. We already do. So next slide. We already said opportunities to drive sustainable healthcare, enhance medication management. You all have heard that so many throughout today. Improve patient outcomes by actively engaging with patients and healthcare teams. We've talked about what's happening here and why it is that way. Strengthen healthcare systems. Enhance the efficiency and the effectiveness of medication-related services. All this you all heard from the previous. Next slide. So how can we do this? What are some of the ideas? One is workforce capacity. What I hear from some of the pharmacists, some of them, oh, we want to do it, but we do not have the time. Have you all heard that too? We do not have the time. What we do, we utilize technicians for the distributive functions. And the pharmacists can then have the time to do the clinical. So that's one way. Now, continuing the education programs. And this is where I need to say this. I don't care how old you are or how many years you've been in pharmacy, you can still do what you want to do. It's up to you. This is your mindset. Residency training and certification pathways. So you can do certification, like the certification programs for diabetes. There's also for hypertension, ASHP, and that's something that CPAN or PSN can do. We can have certification programs. Or what we did in Del Sur, we did the non-traditional residency programs, whereby we looked at the fact that these pharmacists were already practicing and they're working what they're doing in their residency program. So that's another thing. Regulatory framework. You remember what she was saying about the scope of practice. What did you all take from that? What she was saying is there has to be a scope of practice. Pharmacists must know what they're doing. Physicians must know what they're doing. Nurses must know what they're doing. What do you all think is happening here in Nigeria? Do we have the scope of practice? Is our system regulated or chaotic? That's one huge opportunity. We have to define the scope of practice for everybody. The question is, who does it? I think it may be the Ministry of Health, I think. And then, of course, PCN. So, scope of practice. And I hear what the pharmacists are saying. Physicians do not bring the prescription. So they don't see it. So how are they going to? So we have to do what we call a gap analysis and say, why are we doing what we're doing? Find out the issues. That's a big one. Scope of practice. Alright? Then the other one, we have to create mechanisms for recognizing and credentialing clinical pharmacy practitioners. CPAN is doing a great job. They've identified the different specialties. But if I was a manager, which I'm still late at in US, and you come to me and tell me you've done, I think endocrinology is one of the specialties for CPAN. What questions do you think I'm going to ask if I want to hire you? Oh yes, I'm going to ask you. You are not residency trained, then I don't want to know how many years you have practiced in that particular area with certification under somebody. The point I'm making, guys, is that there has to be something structured from an accredited agency. You see, when we do things, you don't just think about today. You also think about tomorrow. You don't know where you're going to be tomorrow. So that is another one we need to look at. So excellent initiative by CPAN, identifying the clinical areas. We just need to take a step forward and utilize all the expertise capabilities that we have, utilize our PCN, and see how can we make it whereby we are relevant and we are able to be marketable anywhere in your country and maybe outside. You're following? Next slide. Interprofessional collaboration. We already talked about clinical pharmacists need to be integrated into the multidisciplinary healthcare teams. I'm a pharmacist, and the physician wrote an order for Levoquin, maybe 750 wrong dose for the patient's renal function, right? And he's the physician. And I called him, Dr. Julius, what is it you wrote here? You writing this for this patient, do you know what the patient's renal function is? The other one is, I called him, said, Dr. Julius, but before I call him, what do? I get my evidence, right? I get my evidence. And then I call him, Julius, this patient, the renal function, what would I be looking at? DUM is this, serum creatinine is this, and you wrote for this dose. And I have evidence here that I want to suggest that you may want to consider a decreased dose. You see, what's the difference between the first and the second? Communication and professionalism. Communication and professionalism. That's one of the things pharmacists get through what? Residency training. Because you're exposed, you're doing it over, you'll be taught. Alright? So communication, that's what I thought. Okay. So foresight culture, teamwork is very important. And respect. Alright? Like what we did yesterday. That was advocacy. We went to the biggest, the highest source. We shared with him what we want. He's directed us on what to do. So you have to use advocacy also. Alright. Now, so a lot of times in the teamwork here in Nigeria, the pharmacists often the listening piece. I think we all agree on that. We have to change. We went through, we got the family, we did that. Now it's time now for us to feel confident about ourselves in terms of practice. And it's time now for us to start becoming relevant in the family. So it's still the missing. And you see where there's the puzzle? The big picture is patient-centered health. Each discipline plays a vital role. You all heard what our nurse said. She said, yes, she will recommend the pharmacist, but she's going to be looking at what? The background. Yes, credentials. She's going to be looking at the credential. Are you qualified to do this? And that's what we're talking about. Next slide. Now, as a pharmacist, and that's where I am, I said that I asked you guys what you all noticed about the speakers. You guys agreed with me that they have a passion. There's something else too. I'm one of the individuals that I'm always thinking outside the box. So my background is nutrition support, specialized nutrition support. I've been coming to this country for years and noticed that there's a high incidence of malnutrition in this country. I noticed that patients who are in the hospital that have surgery, the wound does not heal. Sometimes the wound opens up due to poor nutrition. How many of you have had relatives that ended up in the hospital? They cannot eat because their gastrointestinal tract is not working. Guys, if you think about it, you probably have. How do they feed them? The only way you can feed them is with IV. Either through the small veins or put many people have that knowledge and know that they do that. So knowledge is one. Then the other one is the product. Is the product available? Is it affordable? So what I did is I decided to, with my own money, form an NGO called WASPEN. So the issue is that malnutrition is a significant problem in sub-Saharan Africa. Up to 50% of patients who are admitted to the hospital are malnourished. So the action plan, I started pushing for interdisciplinary nutrition support teams. Right now, I'm working with 3 hospitals that will eventually work. And what would that do? If you have the nutrition support team, indirectly, what am I doing? I'm forcing that teamwork with all the disciplines. Because it's a physician, it's a pharmacist, it's a nurse, and a dietitian. So like my conference that is going to take place in Lut, all of them are working together. And very soon they will have the nutrition support team. Next slide. So this is just talking about the goals. These are the members of a nutrition support team. Physician, pharmacist, dietitian, nurse, and sometimes case manager. And your goal is you want this team, they will be the ones that will identify patients who are malnourished. They will be the one that will work with the physician to decide how to feed the patient. The nurse will be the one to monitor. So every one of them has a role to play. Next slide, please. So these are the roles all of them will play. The dietitian, this is what they will do. The dietary counselor, the nurse has its role. You see how it's well defined. The physician. So that is what I'm talking about. Next slide. You guys have heard about the barriers to interdisciplinary efforts, organization culture. Some people, reimbursement may be an issue. Resistance to change may be an issue. So these are some of the barriers. Next slide. If you really want to do the process, these are the steps you must take. First of all, you identify what it is. You assess the needs and opportunities. You define roles and responsibilities if you want to find a team. Then you develop protocols and guidelines. Then your final step will be interdisciplinary nutrition support. So true patient-centered care is made possible through interdisciplinary collaboration. That's what we must work on here in Nigeria. We have to find out why it's not happening. And the way you can find that out is to do what we call gap analysis. Really get a group together, find out the key points, find out what the gaps are, so that you can go from there. Next slide. We all know that interdisciplinary approach causes, you can get improved health outcomes. Next slide. So looking ahead, finally, I'm going to wrap up now. What can we do? Reflecting on the progress from traditional roles to advanced medical practice, you have to anticipate a dynamic and innovative future for Nigerian pharmacy. We have to think outside the box. We have to be willing to say, hey, we have to make some drastic things. We have to move from maintaining status quo. For example, with the nutrition thing, when I was coming to Nigeria, and I noticed that there's an increase in incidence in malnutrition, I could just come and ask it's not my problem. Right? I could have. But I didn't. I took my own money, I formed the NGO, and I started recruiting. And I've been doing my conferences every year. So we have to move from that status quo to embracing change, thinking outside the box. We have to take leadership roles in shaping the future of healthcare in Nigeria. And it's not just the people in executive position, that should have leadership roles. Practicing pharmacists could also have leadership roles. For example, if you come up with an initiative and you go to your boss and you say, okay, this is what's going on, this is how you can do it, this is what I expect, that's taking a leadership role. So we have to do that. Knowledge sharing and capacity building. Foster mentorship to bridge the gap between experience and your profession. You don't know why I teach? Who can guess why I teach? I teach. And that's one of the things I love most about what I do. You know what? Those you know, then we ask you questions that you don't know. Guess what it forces you to do? You go look it up. It keeps you sharp. And sometimes even when you look it up and you tell them the answer, don't they challenge you sometimes? They say, Dr. Pounds, did you think about this? So what you do coaching. You know what I mean? So it's a give and take situation. That's why I teach. I have students in my ambulatory. I do that constantly because it's a challenge. So we can, and that's something I noticed in Nigeria. The young ones are scared to talk to us. As long as they talk to you respectfully, and you will coach them on how to communicate, that's where it starts. So we have to mentor the young ones. It says right there, promote open-mindedness and mutual respect to advance pharmacy practice. The other point I want to mention here is pharmacists have to learn how to be what? Politicians. I can watch something from him, but the way I say it to him will depend whether I'm going to get it or not. If I antagonize him, I will not get it. But what does it matter as long as I get what I want? So I would talk to him respectfully, you know, but at that thing that I want it. So what am I trying to say here? Communication. Learning how to communicate. So it is very, very important. Next slide. We already talked about advocate for integration of clinical pharmacy into healthcare. Somebody in an institution or anywhere has to be a champion. Like if it's in a hospital, a pharmacist can be a champion. Okay. The pharmacist can be a champion. And then we also need to look at joining professional organizations for advancing practice in Nigeria. I think the last time, my time is up. We need to complete the pause. I would like to end by saying, and I think my president-elect said, and I'm going to say, we have the MOU CPAN. Dr. Mazo and I talk all the time. The CPAN, as far as CPAN, we are with this group. So anything we can do to support advancing, but the main thing we need to work on is that interdisciplinary approach. And we have to work on our training. Our training could be residency or it could be certification, but that confidence has to be there. I think with that I'll end. Thank you for your attention.
Maintenance is key to beauty.